Good evening. This is Dr. David Tam, President and CEO here at VB Healthcare. I believe that the recording has started. I also believe that we are now live on Facebook. And so it's time to get started for our video town hall here from VB Healthcare. And I am sitting here at the Margaret H. Rollins campus. Today is February the 3rd, 2021. It is now 5:12 p.m. and I always make sure that we date and time stamp our video conversations because we will post these on things like Facebook and on the internet so that everybody can have an opportunity to learn as much as possible about where we are today at this very minute with COVID-19, the pandemic, the situation with infection rates, as well as, of course, the big topic, the vaccine issue. So today is Wednesday, February the 3rd, 2021, and it is a little bit after 5. As you can see, we are here today with our American Sign Language interpreters, as well as reading the closed caption so that we can try and communicate with as many people as possible. We also do these in a variety of different languages, including Spanish, so that we can ensure that, once again, this important information is disseminated to as many of our families, friends, and neighbors here in Sussex County. Thank you very much for joining us today. I hope you find this time informative. And the first thing I'll just say is that I think all of us here at VB Healthcare, and I myself included, acknowledge that this is a very frustrating time for everybody as the pandemic continues to drag on and the vaccine seems so slow in being distributed out to everybody in the community. We need to understand and know that the state of Delaware, as well as VB Healthcare, continue to ask for vaccines every single day. We have prepared various plans working with large mass vaccination events like what we did recently in Georgetown last week, 2 weeks ago, partnering with the state to do as many people as possible in their cars at the DMV. We also continue to vaccinate as many people as possible through our own Millsboro clinic, our centralized clinic, and I'll talk a little bit about that in terms of why we only have one centralized site where we take the precious vaccine doses and ensure that every single one is used properly and expeditiously to vaccinate everyone who is currently in phase tier 1B over 65. You need to know that at the beginning, when the vaccine was being allocated out to everybody, we received allocations based upon things like how many healthcare providers we have and who are in, quote unquote, our VB Medical Group primary care network of people over 65. That said, VB Healthcare recognized that our patients are not simply just those who go to see their primary care doctor at the VB Medical Group, but actually all patients who touch VB Healthcare or that VB Healthcare touches across the county, whether they be cancer patients or urology patients or pulmonary patients, endocrine patients, surgical patients. And so we made the decision that we would open up our own VB wait list that you can access through our website, vbhealthcare.org, and fill out your information on a secure a form that puts you on a list so that whatever your primary care provider is, however you access healthcare, we want to make sure that you are on our list so that when vaccine becomes available, you will not be lost, that you will have a place with us. Of course, we also recommend that you get on every other list with pharmacies, Walgreens, Rite Aid, that you have the opportunity to communicate with your own primary care provider if they have a list of people waiting to get a vaccine. And of course, with the Delaware site. These are all things we'll talk about. But at the end of the day, if you are in a place where you are looking for your first dose or making sure, however you got your first dose, that you need to get your second dose, make sure and sign up with us, because we don't want to forget you. We want to make sure that your name, your conditions, your age, your contact information are all in our system. We do this so that we can make sure that we have every potential plan available so that when the vaccine is distributed to us, we can do everything from small community events like the event that we just recently did and partnered with in Georgetown. I'll talk about that in a minute, to our own clinics, potential of even more clinics, other community sites, and even to those mass events like we did in partnership with the state of Delaware at Georgetown just 2 weekends ago. So you'll hear more about that. And once again, we remain hopeful that the vaccine will be allocated and distributed much more as the distribution process ramps up, especially in the last several weeks or several months. We continue to operate the BB COVID line, which gives you an opportunity to ask questions about things like, when can I get my second vaccine? Who should get the vaccine? I have these other medical problems, and therefore, should I get a vaccine? And so all those questions can be answered by reaching out to our BB COVID line. Also for information about where to get tested and some of the things that now seem old hat to us. And then finally, you need to know that we continue to update our bbhealthcare.org website with the latest vaccine information. We try and do everything that we can in a scientifically appropriate format, that we look at all the literature out there so that we can give you the best advice on what should be done, what you should be thinking about, and how we can work together to combat this pandemic. And so we'll continue to communicate with you through things like these town halls, through Facebook, regular Facebook, our Facebook page, our emails that go out to you, and a variety of different formats to ensure that you have all the information that you need. But for today, we're going to be doing this town hall. And so as always, I'd like to make sure and introduce my partner, the BB COVID-19 Medical Director, Dr. Bill Chazanov, who will give you the latest information on the vaccine as well as other things related to COVID. And then I'll come back, and then there'll be a question and answer period as well. Dr. Chazanov.
Thank you, Dr. Tam. I greatly appreciate that. And I want to thank everyone who is spending time with us this evening so we can update you to the best of our abilities, and also to thank you for the sign language interpreters for spending their evening with us as well. It is my pleasure to talk to you about some updates on COVID-19, which will hopefully allow some of the questions that are in your mind to be answered. I want to talk about what COVID-19 looks like in the state of Delaware and our community, and of course, BB Healthcare. So for those of you who may not know me, I am Bill Chazanov, and I appreciate Dr. Tam's introduction. I am an infectious disease physician here at BB Healthcare. I've been with BB Healthcare for a little over 3.5 years now. I've been operating as a COVID-19 medical director for the past year. I was born and raised in Milford, Delaware, and currently live in Lewis for the last few years. With that being said, I want to start to discuss about where we are with COVID-19. In the United States, we are overall seeing less new cases on a day-to-day basis of COVID-19. But I do want to point out that the country is still seeing approximately 140,000 or more new cases on average every day, and that's an average over the past 7 days. So we are by not any stretch finished with COVID-19, although at least it appears that some of the numbers are improving. Unfortunately, we have also had over 446,000 deaths of United States residents since the beginning of the pandemic. And these are deaths that have been caused by or contributed by COVID-19. In Delaware and in Sussex County, the number of new cases on a daily basis also appears to be decreasing as well. Although we have unfortunately lost greater than 1,100 Delawareans due to COVID since the start of the pandemic. In Sussex County, The average number of new active cases seems to be decreasing, which is great news, but I do want to point out that we continue to see new cases on a daily basis. So again, we are far from being done with COVID-19. When looking at the state of Delaware hospitalizations, this number continues to decrease as well, which makes all of us happy, meaning that less people are as severely ill as they were just a few weeks ago. That number continues to still be in the mid 300s to low 300s. So today, we had approximately 330 people hospitalized throughout the state of Delaware because of COVID-19 or COVID-19 related issues. What we saw in the end of April and in the beginning of May was what we call our first surge or our first peak. Unfortunately, over the last few weeks to couple months, we have seen a second peak or a second surge that was actually worse from a hospitalization standpoint than what we had seen in the spring of 2020. Our hospitalization numbers throughout the state were higher than they were back at the end of April or the beginning of May of 2020. So it is nice to see those numbers decreasing. With that, I also want to point out that during the first surge or the first peak, Sussex County seemed to be hit harder than Newcastle and Kent County. Not to give anyone the impression that Newcastle County or Kent County were spared, the second surge seemed to be more affecting of Kent County and Newcastle County than it did of Sussex County. And again, that does not mean that Sussex County was not affected by the second surge, because we were. With that being said, I always think that it's important to talk about what the hot topic or hot topics are in the news. And obviously one of those is the vaccine that we are going to talk about very shortly. But before we do that, I'm hoping that we can spend just a few minutes to talk about the different variants or strains of COVID-19 that have been discussed all over the news in the past few weeks. There are currently 3 variants or strains, and I will use the variants and strains word interchangeably, that are being discussed very frequently in the news. I need you to bear with me just for a second. I don't expect anyone to remember the specific numbers or the names of these variants, except to know that there are 3 different variants that the Center for Disease Control is currently monitoring. The first one is known as variant B as in boy, 117, and this is also known as the United Kingdom strain or the UK strain. This strain of the COVID-19 virus was identified in the United Kingdom, hence its name, in the fall of 2020. That strain had not been identified in the United States up until last month, being January. So we do have the B117 or the United Kingdom strain identified in the United States. The second variant, known as B as in boy, 1351, is also known as the South African strain. This was initially detected in October 2020 in the was detected in October 2020 and also was identified in the United States last month. This strain, which is B1351, appears to be somewhat similar to B117 in that it has the chance of being more infectious than the prior COVID-19 strains that we had identified several months ago. There is a third strain that I just want people to be aware of. That strain is known as P as in Paul 1, and that's also known as the Brazil strain. This variant was also detected at the end of last month in the United States as well. So all 3 of the strains that we have just briefly discussed that had been followed by the Centers for Disease Control have all been identified within the United States. So how do we identify these strains? Well, as someone tests positive for COVID-19, there are random samples of those positive tests that are sent to the state of Delaware Public Health for us and or the Centers for Disease Control. And they basically perform what we call sequencing, which is a fancy word for looking at the blueprint or the genetic blueprint of the virus to look to see if there are significant differences from the virus that they knew from several months ago. That's called a surveillance program. So the Centers for Disease Control in the state of Delaware Division Public Health has been doing surveillance now for several months to identify any specific differences in the strains of the virus. So again, those 3 strains of the virus that I just discussed are B as in boy 117, B as in boy 1351, and then P as in Paul 1. And all 3 of those strains have been identified in the United States. Research continues and is ongoing about how these strains are different. And what I mean by different is that we know that they have some, their blueprint is a little bit different than the other strains, but how are they different from an infectious standpoint? Well, I had talked about briefly that we know that the B117 and the B1351, so 2 out of those 3 strains, appear to be more infectious than the strain of the COVID-19 or the strains of the COVID-19 virus we knew about 10 months ago or 11 months ago. The good news is that it does not appear that any of these strains are deadlier, meaning that if you were to become infected or contract one of these strains, that you have a chance of becoming more severely ill or potentially passing away than the other strains that were out there. Now, the disclaimer to what I just said is that more research is ongoing, so that could change as that research matures and we have more information. So I'm telling you what I know at this point and what has been published at this point. And I think that's extremely important to remember, that during all these town halls and everything that Dr. Tam and I speak about, all of this information changes very quickly, and we do our best to try to keep you up to date. So with that being said, I think it's a perfect time to kind of talk about the vaccines. And with those 3 strains that I just mentioned of the virus, it's important to realize that research is also going on to make sure that the vaccines that we have on the market now and the upcoming vaccines that will be on the market hopefully soon have activity against not just the coronavirus strains that we knew about, like I said, several months ago, 10 months ago, 11 months ago, but also the 3 strains of virus that we have now identified that are different. So there are 2 vaccines that have received the Food and Drug Administration from the United States emergency use authorization. For most of us that listen to the news or read the papers, these are the Pfizer vaccine and the Moderna vaccine. Both of these vaccines use the same type of science that basically allows our body, after the vaccine is injected into us, to produce an immune response against the COVID-19 virus. I think it's extremely important to remember that neither of these vaccines contain live virus. So I'll repeat that again. So neither of those, neither the Moderna or the Pfizer vaccine contain any live virus. So that's very important because that's one of the questions that I know I am asked frequently, and I'm sure that Dr. Tam and many others are asked frequently as well. Because there is no live virus that is in the vaccine, it is not possible to become infected with COVID-19 because of the vaccine. So you can't get the vaccine and then develop COVID-19 because of the vaccine. Now, what is important to remember that these 2 vaccines were created to help protect us from becoming severely ill and helping protect us from dying from the COVID-19 infection. What we don't know, and as more time goes on, is how much protection these vaccines actually provide us from becoming infected with a virus. So I say that because even after you have had both doses of either the Moderna or the Pfizer vaccine, there is still a chance that you could become infected with the COVID-19 virus, which brings me to the point that I think is extremely important for all of us to constantly hear, is that it is imperative for all of us to follow the 3 W's even after receiving the vaccine, and that is to wear a mask, wash your hands, and to watch your distance. Those three things will continue to save multiple hospitalizations and multiple lives. I know that one of the questions that I receive and that Dr. Tam receives often is how can I receive the COVID-19 vaccine? Well, I know that Dr. Tam had discussed that briefly, and I'm going to just elaborate for a couple minutes on how someone may be able to get the COVID-19 vaccine. Before I do that, I do want to just discuss about here in the state of Delaware that we are currently operating in a master blueprint that the state of Delaware has created with a guidance from the federal government, and we are underneath what is called the 1B, B as in boy, phase. So let's talk about these phases for a moment. I think this is extremely important for everyone to understand. So what the state of Delaware, with the guidance of the United States, has come up with is that they have placed lots of us into different phases and tiers, knowing that not enough vaccine would be available at first. So for instance, in Delaware, the highest phase that's out there is called phase 1A, A as in apple. And what that includes are frontline healthcare workers, those who may have the potential of coming face to face with someone with COVID-19 as a patient or taking care of someone with COVID-19. We're also handling infectious material, being in a hospital, working in a laboratory that may have to deal with certain specimens and samples. Also included in that phase or tier 1A group are long-term care residents. If anyone is able to look at the state of Delaware website, My Healthy Community, that updates at least on an every other day basis, you will see that out of those 1,100 deaths that I discussed earlier for the state of Delaware, unfortunately, a large majority of those were secondary or occurred in long-term care residents. So we know that they are a very high-risk group of individuals that unfortunately have passed away or had a high mortality when they became infected with the virus. So after 1A, we now are operating in 1B as in boy. So what that includes are those who are over 65 years of age, along with other sections of our community. And that includes educators, essential frontline workers, production line employees, and many others. What the state of Delaware has decided to do initially with this 1B is to focus on those who are 65 years or older, trying to get a jump start on that group, and will eventually open that up as more vaccine becomes available to that other section, or those other sections that include educators, essential frontline workers, and production line employees, and many others. So with those guidance or that guideline or guidelines, that's how we are operating at BB Healthcare. And I think that that's really important to know that the state is putting the structure of how we can offer vaccine to our community. I do want to talk about numbers for a second because I think it's really important for all of us to hear this. So the amount of vaccine that we receive is very challenging. We know that we don't have enough vaccine at this moment to vaccinate everyone who is included in a 1A or a 1B phase or category. So when Delaware opened up the 1B, so we have 1A at the top and 1B is next, when that happened, that opened up to about 20% of the entire population of the state of Delaware. Delaware has roughly 1 million people who are considered residents within our state. So that opened up approximately 200,000 individuals who now became eligible for the COVID-19 vaccine. If you think about that, and knowing that the vaccines that we currently have available, the Moderna and the Pfizer vaccine, both require 2 doses to complete the series, that would require 400,000 doses of vaccine in order to vaccinate the 200,000 people who might want that that became open as Delaware moved through phase 1A to 1B. I say that because patience is obviously important here, but that does not mean that there aren't certain things that you can do to help receive the COVID-19 vaccine. So again, as Dr. Tam had discussed, there are several options to get onto lists to receive the COVID-19 vaccine. One of those is the state of Delaware has a COVID-19 vaccine registry site, so you can register there. BB Healthcare, knowing that we needed to serve our community and the people that BB Healthcare touches, we also have our own registry list. And as Dr. Tam had alluded to, if you go to bbhealthcare.org and you click on the link for COVID-19 Resource Center, you will see a button for vaccine information. Please click on that, and that will take you to a list that you can register on BB Healthcare's list. Other places, such as commercial pharmacies, Walgreens, Rite Aid, CVS, they are all operating lists as well. So it's important that if one of those is your recognized pharmacy or something that's close to you, you may want to register with that organization as well. One of the questions that I do get asked, and I've been asked frequently this week, is that if you register for one of those lists, it does not interface or automatically put you on the other lists. So for instance, if you register at BB Healthcare on our vaccine list, it does not mean that you are automatically registered in the state of Delaware list or at the Walgreens. So it does take some legwork the way that things are set up right now if you would like to be a part of several lists, which there's nothing wrong to do with that. And I would encourage for those who have the time to consider doing that. With that being said, it's also important to realize that if you do register at least, through BB Healthcare, through our list, and you are not eligible for the vaccine at the time, for instance, we are operating in phase 1B and you don't meet criteria for phase 1B, you are still on the list. We don't cross you off. When you do become eligible for the vaccine, at that time, you will then go through the list again and be offered vaccine as we have vaccine available. Another question I am asked often, is the vaccine safe? And I think it's probably worth a minute or two to just talk about the safety and how the vaccine has come to market. So one of the side questions I get asked is, this vaccine came out so quickly. I mean, there's no way that this can be safe. I mean, it was out in a year. Is this okay to take? Well, I want everyone to know that the Moderna and the Pfizer vaccine both went through the same steps for vaccine approval that any other vaccine goes through. The entire process was faster than usual because the entire world put multiple resources around the science, development, production, and manufacturing of these vaccines to allow what normally takes, one company who may work on a vaccine for several years. It has allowed us to have a vaccine in approximately 1 year. One of the things that I had not thought of until earlier today is, and I don't know, I'm a nerd, so I apologize, but one of the things I found interesting is that we just started to talk about this virus back in December of 2019. And I know that feels very long ago because we're in 2021 right now. But in January of 2020, less than a month, weeks later, after identifying this actual virus, the entire genetic blueprint was put out in public domain, so that way pharmaceutical companies, scientists, other people around the world could start working on technologies to help with testing, but also to help with vaccinations. So that's an impressive feat that normally takes much longer than that. Now, with that being said, here we are on December 11th. The FDA provided the emergency use authorization for the Pfizer vaccine. I mean, that's extraordinary, with the Moderna vaccine being just a couple weeks later. So with that, I want people to know that the safety checkpoints have been met. and more than 70,000 people were included in the Pfizer and the Moderna study that lasted for several months, even after second doses were provided for the Moderna vaccine and the Pfizer vaccine. I think I would be amiss to not mention that there are two other vaccines that are close to potentially being looked at in the pipeline. One is the AstraZeneca vaccine, and the other is the Johnson & Johnson vaccine. It appears that the Johnson & Johnson vaccine will likely come into review before the AstraZeneca one, but just so that people are aware that both of those vaccines are also close to being presented for review. One of the other questions that I'm asked is, do the COVID vaccines have side effects? Well, the answer to that, honestly, is that it is possible, because every vaccine has the potential to cause a side effect. Every medication has the potential to cause a side effect. Every therapy, every test that we do has the potential to maybe cause a side effect. The most common side effect of the current COVID-19 vaccines that are available is a sore arm. 7 out of 10 people will have a sore arm after the injection, and it may not be immediate. It could start several hours later or even the next day or two. This is normal. Sometimes that soreness has some mild redness around there, and sometimes it has a lump associated with it. Those are all fairly normal responses to this injection and to other vaccine injections as well. I will admit that some people will also develop other temporary side effects, such as headaches, muscle aches, maybe a little bit of stomach upset, and some people will even feel like they may have a mild case of the flu for a day or two. Again, that is not uncommon and has been reported with this vaccine or these vaccines. It's important to recognize as well that a lot of times, not just with the COVID-19 vaccine, but with the flu vaccine or the pneumonia vaccine or other vaccines we use to try to prevent illness, that people will have that response. And that can be an individual response. And the reason for that is that sometimes that is your immune system's trigger to tell you that it's working. The immune system is working and it's making you maybe not feel as well as you did the day or two before the vaccine, because your immune system has boosted up. It's now active. And unfortunately, when that happens, it can make us feel like we have muscle aches and fatigue and just not as well as we did. It's also important to realize that if you don't get that response and you do completely well with no side effects from the vaccine, it does not mean that your immune system is not working. So don't worry about that either. One of the things that is important with this COVID-19 vaccine or any medication or any therapy is that some people have questions, as they should, about their own specific medical conditions. So if you do have a medical condition and you're not sure that the COVID-19 vaccine is right for you, my best guidance to you is to please reach out to your provider, your physician, who's prescribing you that medication, in order to have that talk so that you both are educated enough that you can make the best decision for you. And that's really the important part, is for you to be well educated and informed, make the education if this vaccine or any medication or therapy is truly right for you. In the last minute or two, I just want to talk about a couple other things. There's a lot of discussion right now from the federal government and the state government about the availability of not just COVID-19 vaccine, but also the second dose of COVID-19 vaccine. The supply of COVID-19 vaccine comes from the federal and state government. That is the only way that we have our opportunity to receive vaccine. At BD, I can tell you that I and Dr. Tam and the rest of the team, we all take pride in taking care of you and doing the best we can. And part of that is by making sure that we can secure as much vaccine as possible. And I tell you that we will continue to do our best to obtain as much COVID-19 vaccine, be it a first dose or a second dose, as possible. I will tell you that we will work just as hard for a second dose, if not harder, than we will for the first dose for you. And I want you to know that this is a an unrelentless approach with dealing with everyone to make sure that the state has what they need from us and what we need in order to do our best to get the vaccine to you. There's two last things that I want to just point out. As Super Bowl Sunday approaches us, please remember the social distancing, the physical distancing, and the 3 W's, which include washing your hands, wearing a mask, and watching your distance. I know that Super Bowl Sunday is normally an exciting day where people from maybe not in your household are there, but it's really important to continue to do what we know has kept us safe, our family safe, our neighbors safe, our community safe. So with that, I wish you all a good evening, and I'm going to turn this back over to Dr. Tam. Thank you for your time.
Thank you, Dr. Chasanoff. So I've been listening, and first, please know that up to this point, Dr. Chasanoff's mic has always been working well. I don't know what happened today, so I apologize for the fact that there was a little bit of interference with his microphone. We'll take a look at that and we'll get it fixed. You need to know that Dr. Chasanoff actually has a beautiful voice, for those of you who have listened to him. And part of the beauty is not necessarily the throat, but the fact that he speaks with such passion and such clarity and from the heart, as someone who was born and raised here in Sussex County, went away to school, but decided to come back and serve here in Sussex County. And, you know, those are all just absolutely beautiful things. I've been reading, you know, one of the things about Facebook Live is I get to watch all your texts and all your responses and messages. And I've been struggling with something about whether I should say something or not, and I am going to. So you know that this is not scripted. On behalf of everybody, I'm sorry. I'm sorry that everybody here is going through such a hard time. I know that this is the most frustrating situation for so many of you, as we are now at a point where we see things sort of, you can see the light at the end of the tunnel, and the vaccine is working, or the vaccine is efficacious, as Dr. Chasanoff said. And yet, let's go. Let's figure out what to do. Let's get on a list. Let's get that vaccine. And, you know, on behalf of just healthcare in general, I'm sorry that this has been not so easy for all of you to navigate. I can tell you that there are all kinds of reasons. And I can tell you that some of it is federal, or some of it is state, or whatever. But at the end of the day, we here in healthcare have a responsibility to do better. And I promise you that it's what Beebe Healthcare is struggling to do and working very hard to do. And that is to make sure that nobody is left behind, that everybody has the chance to get a vaccine in whatever methodology, format, location that you can. You know, there is not enough vaccine out there. There is no cache of vaccine in our refrigerator or vaults that would get everybody, vaccinated all at one time. We receive doses and allocations on a regular basis, but it is sometimes just waiting to see what will come. And so that's why we created that list that is on bbhealthcare.org, and that list that, by the way, is open to everybody in Tier 1B at this point, because that's the population that we are trying to vaccinate. Those are the population, the people at risk, that we are trying to vaccinate as fast as possible. And we open that list to everybody so that we can make sure that those people will get a vaccine as soon as we get that allocation from the state. I will also tell you that I learned in the Navy that the people with the plan and the ability to execute that plan are the people that often get the resources. And so please know that the state of Delaware, the governor's office, everybody knows that we have the methods and the plan to do the COVID-19 vaccine distribution as quickly and as efficiently and as safely as possible when we get the doses. And so that's where we're at. You know, I wish it was, like I said, an opportunity where the doses were available and we could go out there and get it. That's one of the reasons why I also saw on a lot of the messages about some of the confusion. Walgreens has their own list. Rite Aid has their own list. The state of Delaware has their own list. And yes, it's true, BB Healthcare has its own list. And the goal here is to make sure that people are not left behind. I've already talked with my staff. While Dr. Chazanov was talking, I was emailing some of my staff about how we can make sure that those who are or think they're on a list, how we make sure and confirm that you're on our list and how we communicate with you, because we do need to make sure that you feel confident in our abilities to reach out to you if and when, or not if, because when the vaccine dosages are available for us to distribute. And so we're working to continue to improve this process as we do this. Here's what I do know. BB Healthcare, you know, I've been here since March 17th when the pandemic started. We have always done everything we can to make sure that the community is supported and that we deliver healthcare to our community. We kept the hospital open during the spring peak and then, of course, the winter peak. During the winter peak, we even kept all our services open. You know, we continued to do all the surgeries and all the procedures necessary to take care of people's health, even though we were inundated once again with patients. As Dr. Chazanov said, we had so many patients here in the winter peak, which just finished about a week and a half ago, that we actually had more patients in the hospital with COVID-19 than in the spring. We knew better ways to take care of those patients. We had more treatments, and as a result, we did well, and the patients did well. We're at a point now where really we need to work on this vaccine distribution, and this information changes on an hourly basis, but you have my commitment that we are continuing to work with all available distributors and the state of Delaware to get as much vaccine as we can, not just for BB, but for the people of Sussex County. So bear with us, have patience with us, make sure that you reach out to us if you're concerned about whether or not you're on a list and where you are on the list, so that we can also communicate with you when your doses are up, when it's your turn to either get the first dose or when we have the doses available to get you that second dose. Those are all the things that we are working on here to ensure that the community is protected. The last thing I'll just mention is that, so, you know, although I'm sort of a doctor on TV now, right? I don't practice anymore like Dr. Chazanov or the 180 other doctors that we have and providers that we have here in BB Healthcare, you know, taking care of patients. I can tell you that, yeah, I'm a doctor. And, you know, one of the things I learned in medical school was something that Dr. William Osler said, you know, almost like 100 some years ago, over 100 years ago. Dr. Osler was a physician from Canada, but he came to the States, and in fact, he's one of the founding fathers of the Johns Hopkins University. Many of us in healthcare consider him the father of modern medicine. And one of the things that he said, and I'm going to read it here so I can make sure I say it right, is that medicine is a science of uncertainty and an art of probability. You know, every time a patient comes in and gets a surgery or gets some kind of treatment, every time they come into our emergency room, there is some level of uncertainty that, you know, we all feel. You know, medicine is not an exact science, but it is a training that the doctors have, their skills and their capabilities, and of course the technology that we have at the hospital that gives us the confidence in managing some of the uncertainty about taking care of people, especially in crisis situations. That's what we do in healthcare. That's what we do here at BB Healthcare, is work with that uncertainty with our skills, with people like Dr. Chazanov, with people like Stephen Geiser managing, all the vaccination process. And we work to make sure that we deal with the art of probability, because it is a good probability that very soon these United States of America, where we've survived so much crises in the past and might have started a little slow, but towards the end of a war or in the middle of a war or something like that, we were producing things, we were making things, and I have every confidence that the probability of the vaccines coming out will increase in number very shortly, and BB Healthcare will be at the front of the line with the plans necessary to say, give us all the vaccines you can, and we'll use it with dedication, with skill, and with accuracy to make sure that we don't waste a single drop of that vaccine. That's what we're trying to do here at BB Healthcare. Manage the uncertainty, help deal with the probability, and help you all in that process. Please remember that during this 10.5 months that I've been here, and of course during the pandemic, we've still been able to open up a new cancer center. We've still been able to open up a new freestanding ED, both in South Coastal area of this county. We've opened up another a family practice clinic in Millsboro. We've continued to grow and develop, and we'll be bringing online in just actually a few weeks, breast cancer surgeries, neurosurgeries. We have endocrinologists, pulmonologists. We have more ICU physicians. We have 3 infectious disease experts. We have 4 endocrinologists. These are all the things that we have continued to build despite the uncertainty, because we know that the probability exists that when this pandemic is over, you will need us to continue delivering healthcare. So thank you so much for your trust. Thank you so much for being patient with us. And thank you so much always responding and emailing me, as well as my colleagues, on how we could be doing things better, whether it's Bill Chazanov's microphone or how to make sure that we communicate back with you about the list. The last time we had a pandemic like this was about 100 years ago. I hope we never have one again, or at least if we do, it's not for another 100 years. And many of us will not be here. But during this time, we will do this together, and we will come out of it together. And when we do, you'll find that BB Healthcare is your community healthcare resource. And I thank you for your support. I thank you for continuing to give us your trust, your financial support, your philanthropic support. All those things are critical to helping us remain local, nonprofit, independent, and community focused. So on behalf of every single team member here at BB Healthcare, on behalf of all the physicians, all the nurses, all the housekeepers, everybody here whose mission is to take care of you, thank you so much for listening today. Thank you so much for your trust. Thank you so much for your patience. And I hope to see you soon. That we'll be able to get together and enjoy each other's company and fellowship in the months to come. Have a good night.